Hi, my name is Stacey. I am the Division Chief of Pain Medicine at the University of Washington here in Seattle. I'm happy to spend a few minutes talking with you about integrative medicine and my journey to it and with it. I am not a practitioner of integrative medicine or alternative medicine approaches. I am a supporter. If you are a patient, I want to encourage you to explore these options. If you are a clinician, I want to encourage you to connect to resources. If you are a researcher, I want you to think about research opportunities in the world of integrative medicine. Starting out, I saw that many patients were not satisfied and they wanted alternatives. They weren't being served by traditional approaches. They were seeking alternatives and often not telling their doctors what they were finding and what they were doing. I learned about dry needling, acupuncture, relaxation, hypnosis. I met people interested in getting those services and those who provided them. And as I talked to them, I discovered that there are many, many questions and many areas to look at. Like, what do the practitioners understand that they are doing? What do they think they're doing? What do they know is just a belief or an understanding versus what do they really truly know? What is their language? What language are they speaking? What does their language mean, and how does it relate to how other people describe things? How does it work? Who does it work for? Those kind of things. What are the mechanisms? I found this really quite fascinating, and I was really interested in incorporating it into my practice and with my patients. So I reached out and connected with resources, and those resources were in my community. They were within university and research academic settings, and some were definitely not in those kind of settings. By doing that, I was able to bring together different resources and different people with different perspectives with a common goal of helping the patients that they were seeing. If you are a patient, most places you have to be at the center, which is a good thing, but the bad thing about that is you're kind of the conduit of information between these different worlds of providers, which can be a traditional allopathic physician or other medical practitioner, together with some folks who are practicing alternative medicine or integrative medicine approaches, helping them connect and making sure that the treatments coordinate together well and work together well. This means you've got to be the go-between in these situations, and sometimes it's a bit of a challenge. I will say that I think it's worth it, that by exploring these options and thinking about what you need to feel better and to have a more complete and full life, that's how you're going to be most satisfied in the end. And think about the big picture things. You want to be able to do what's important to you. You want to be able to share those experiences with people around you who are important to you. You want to be able to do that for the most part in comfort as much as allowable. And we all have preferences, and you need to find people who will honor those preferences. I think that's what integrative medicine is about, and I think that's what's exciting about it now, is that there's a focus and understanding that there are many approaches and paths that work for patients, and I want to encourage all of us, whether we be clinicians or researchers or patients or sometimes all three of those things rolled into one, to really think about these big picture issues. So thank you very much for this opportunity to spend a few minutes talking with you, and best of luck. Bye-bye.